Atypical antidepressants. A typical antidepressant includes Trazodone, bupropion, mycin, nefazodone, mirtazapine. Now, why we call them atypical antidepressants? Because they act by some different mechanism. They act by inhibiting the reuptake of some dopamine or some by acting on alpha receptors. Means the mechanism of action is different from the tricyclic antidepressants, SSRI or SNRI. Means they have some different mechanism of action. That's why we call it as a typical antidepressant. Fewer side effects, particularly sedation and anticholinergic side effects. They are safe in overdose, effective in patients who do not respond to the TCA and SSRI, means tricyclic antidepressants and SSRI, or selective serotonin reuptake inhibitors. The first drug in that category is the Trazodone. Trazodone is a prominent alpha adrenergic blocking effect and serotonin reuptake inhibitor. The mechanism of action is slightly different. That's why a typical antidepressant, Trazodone. So this Trazodone, prominent alpha blocking and serotonin reuptake inhibitor. This Trazodone is the only antidepressant which causes bradycardia. All other antidepressant causes tachycardia or reflex tachycardia. It's a short acting, plasma half life is just 6 hours, and it lacks anticholinergic activity. It has mild anxiolytic action. It is well tolerated and it is safe in overdosage. As adverse effect, it may lead to postural hypotension and priapism, that is painful penile erection, due to its alpha 1 blocking effect. So Trazodone, what are the adverse effects? Postural hypotension and priapism. What is my priapism? Painful penile erection due to alpha 1 blocking effect. Now next drug is the nefazodone. Nefazodone, it blocks the serotonin reuptake. It's a shortest acting antidepressant. Shortest acting antidepressant means duration of action is very short. It is well tolerated on oral administration. It causes sedation and mild postural hypotension, and it is used for the prophylaxis of recurrent depression. Next drug is the mirtazapine. It blocks 5-HT2, 5-HT3, alpha 2 receptors, and that's why it enhances the release of noradrenaline and 5-hydroxytryptamine. It is a faster acting drug. Action starts by the end of 1 week of treatment. It causes sedation, but other side effects are negligible. Now, the most commonly used drug, bupropion, it's a dopamine reuptake inhibitor. And it has a CNS stimulants effect. No other antidepressant inhibit dopamine reuptake. Bupropion is the only drug which inhibits the dopamine reuptake. It is used in depression with anxiety. Bupropion is also used to stop the smoking addiction along with nicotine transdermal patch. Now, where we use all these SSRI, tricyclic antidepressants, or atypical antidepressants, SNRIs, monoamine oxidase inhibitors, we used in the endogenous depression or major depression. Antidepressants are used over a long period, at least for 4 to 6 months. The response appears after 2 to 3 weeks of treatment. The choice of drug depends upon the side effects and patient factors like age. In severe depression with suicidal tendencies, you can go for electroconvulsive therapy. Panic attacks or post-traumatic stress disorder or other anxiety disorders, they all respond to antidepressant. Acute episodes of anxiety are known as panic attacks or panic disorders. Obsessive compulsive disorders, SSRI, and clomipramine are effective, or we can say it's a drug of choice. Nocturnal enuresis in children, or we can say bedwetting, may be treated with antidepressants only when other measures fail and drugs are indicated. Means first of all you have to do the counseling, then you have to do the other non-pharmacological treatment for the bedwetting. If it is failed, then you can go for the imipramine 25 mg at the bedtime for nocturnal enuresis. You can also use this drug for psychosomatic disorders. Like newer antidepressants are tried in fibromyalgia, irritable bowel syndrome, chronic fatigue, migraine, sleep apnea. Other indications like ADHD, that is attention deficit hyperactivity disorder, chronic pain, chronic alcoholism may result in depression, and depressions can be used in all these conditions. So, this is all about atypical antidepressants.